I'm Jayaprakash Dwivedi, Chief Information Officer of Rajiv Gandhi Cancer Institute and Research Center. Last 12 to 13 years, I have actually witnessed drastic changes in the healthcare arena. Let us start with very simple thing. You must have seen people carrying films, X-rays and CT and MRI, not long back, but not any of those anymore. So filmless diagnostics is the first visible change that we see in the healthcare arena. Then look at the nursing documentation. Nurses used to fill up plethora of forms, registers. Now most of that has gone. By and large, is the practice in every hospital. We see the online workflows in the clinical side also. So whatever orders doctors are actually placing, most of them are now coming through computer and being followed without any paper being carried from point A to B. So these are changes which very clearly have actually been implemented everywhere. Now there are a few changes which are in progress that we see. And very first one is electronic health record adoption now. This is happening and is at various stages. Some hospitals have now implemented technologies like CDSS and analytics. So clinical decision support system helping them making better and more informed decisions. Then we also see AI-enabled diagnosis being adopted in hospitals at various stages. AI-enabled clinical interventions like robotic surgery, TACE and TARE, transarterial chemoembolization and radiation embolization. These are all supported by technology and are seen, at least I can talk about cancer centers. See, I feel so blessed to work as a CIO in this arena. We are now no longer treated as cost centers. We are enablers, drivers, and people look up to us whenever there is any improvement required or seen. Even we are expected to suggest the improvements, disrupt the processes, and our disruptions are not being registered any longer. So this is very exciting. People actually invite now CIO with suggestions on improving technology, workflows, business processes everywhere, and even radical changes in the way we are conducting our business. So it is very exciting, rewarding, and pleasing. So pandemic is the senior most CIO globally. It has brought about the changes that we could not even have thought about. Doctors are very happily embracing telemedicine now. Patients are able to communicate. There are a lot of positive side effects that, not only the time saving, but a lot of cost saving is also there. So people don't need to necessarily travel. Hospitals are now relatively less crowded because of this telemedicine. Then patient app. So patients are able to book the appointments. They are able to see their results, their prescriptions, discharge summaries. A lot of changes have come in place because technology is now allowed to play its role. And in fact, not only allowed, but encouraged and expected. So a lot of changes really visible on the horizon. And I envision that, more than 50% consultations in near future will happen through telemedicine. So people will stop visiting OPDs unless it is absolutely necessary, not at least the first interaction. Maybe doctor will advise some tests, and then second time they can come along with the reports, etc., which will be much more productive usage of the doctor's quality time also. See, look at the pandemic and look at how India performed. We have responded in one of the best ways, and world is looking at us as global leaders. Look at the Arogya Setu app, CoWIN app that we came up with, and technology actually is putting us in the forefront. We now need to move to wellness. Really do health care, as I often say, rather than doing health repair. In the first, instance, we should try to sniff the symptoms which are going wrong and try to address them before they start damaging our health. So the wellness, more awareness, more education, more connected health, some wearable devices, actually watching over our health 24/7, and allowing the hospitals and clinicians to intervene in time. That will reduce the number of beds required in the hospital. It will reduce burden on the healthcare delivery apparatus, and overall, it will reduce the cost countrywide, public and private both. See, biggest cost is technology. We will have to subscribe to or create or build or hire technology and manpower, the people who can use that technology. So IT spend is going to increase manifold, and that is unavoidable. It has to happen. Associated with it is the biggest risk. So number one risk is, now there are no papers, there are no medical record departments keeping, archives. Everything is online on computer, and it can be attacked, it can be destroyed, it can be stolen. So the data security and privacy will come as one of the biggest risks. Second risk is attrition. When your trained manpower suddenly vanishes or changes the ports from one to other, there will be disruption in the services. So we need to be prepared for all those risks coming in future. But rewards are manifold. Increased reach of the healthcare reaching the doorstep of the patient rather than patient coming to healthcare. Increased affordability, improved processes, reduced LOS, average length of stay in the hospital, improved processes, better patient experience, better clinician experience. Everything will be ensured through effective usage of technology. Yeah, and Ananta, we should not wait for the attacks. See, attack does not happen in one day. If you study the behavior of these ransomware attacks, there are malware snippets lying there. There is a dormant piece of code that is already residing inside your databases, inside your data center, and it is lying dormant there. Suddenly one day, after gathering all the necessary information, it just explodes, and then situation gets out of control. So we have to deploy technologies that can intelligently assess the behavior of entire network. What is going on? Is there anything suspicious? Is there anything which is abnormal? Start studying early on and take the necessary steps to prevent these damages. Because retrospectively, it is very, very difficult to see the real ramifications of these attacks and actually address them. There are regulatory problems. There are, reputation-related issues. There are a lot of collateral damages which are associated with these incidents.
For more updates from CXO TV, please like and subscribe to our channel.